Hi, I'm Dr. Matthew Nussi, and today I'm going to give you some tips that you may be able to use to help maximize your chance of passing your DOT physical. So, if you drive commercially, chances are you are going to need to complete a Department of Transportation, a DOT physical, so that you can continue to drive. Now, there are dozens of videos here on YouTube about how to prepare to take your Department of Transportation physical. As a matter of fact, I've done one of those videos in the past. You can check that video out here. This video is about tips that you can use to maximize your chance of passing the Department of Transportation physical. So, a little bit of background about me. I have been a certified medical examiner contracted to do Department of Transportation physicals for about 6 years now. And in this period of time, seeing hundreds of patients, I have seen what hangs people up and what we need to refer out to get further testing for and what we are unfortunately not able to pass drivers for. So some of these things can be avoided, and that's what I want to go over in this video. Okay, so first a disclaimer. This is not about how to cheat on your Department of Transportation physical. Obviously, we don't want to certify someone that should not be on the road. But there are, again, things that you can do that you can go in prepared for that can maximize your chance to pass the Department of Transportation physical if applicable. So let's get right into those tips. Okay, so tip number one is you want to come in to the test prepared. So I think this should be obvious, but sometimes it isn't. What is preparation? So in the description down below, in the description box below, I'm going to put a link to the Medical Examiner Handbook, and anybody can get this information. Now, it's very, very lengthy. It's got a lot of medical jargon in it, so I'm not suggesting that everybody needs to read through that to be prepared to take the physical, but there are going to be some things that are applicable to you that aren't applicable to the next person. Let me give you some of the big ones that I've seen through my practice. If you wear glasses, you're going to want to bring your glasses with you because we are going to test your vision, and if you can't pass the vision portion of the Department of Transportation physical, then you can't pass the physical. If you wear hearing aids, bring your hearing aids with you. We're going to test your hearing as well. Bring any medications that you take with you, or a list of medications that you take with you. Just because you take medication does not mean that we are going to disqualify you, does not mean that you cannot pass the Department of Transportation physical. But we do need to see these medications, and it can alter the length of time that your certification will be good for. So there are many different ways to prepare to take your physical, but being prepared is the number one tip that I can give you to help maximize your chance to pass the DOT physical. Okay, so on to tip number two. This is an important one. Tip number two is when the certified medical examiner asks you a question, answer that question directly. So what do I mean by that? So you want to answer questions as directly as you can. So what we are going to do is have you fill out a history form, and then based on what you write on that history form, we are going to be asking you certain questions. You'll want to give us as direct of an answer as possible. So let me give you a little bit again of my experience. I've seen, again, hundreds, maybe thousands of patients up to this point. And I've heard from patients that sometimes they will have gone to another certified medical examiner in the past to get their DOT physical performed, and that provider will be sending them out to get additional testing, which is not a bad thing. But our job is to make sure that you meet the absolute minimum standards so that you can be on the road. It's not to make sure that you are at 100% health. That is a completely different type of examination. The FMCSA actually sets up all of the standards that you have to meet. It has nothing to do with what the physician actually thinks as far as figuring out how healthy you are. So our job is to apply this minimum standard. So let me give you an example. Let's say that you previously had high blood pressure and you started eating healthy, exercising, lost a bunch of weight, and now you no longer have high blood pressure anymore. And me, as the certified medical examiner, asks you, do you have any problems with your blood pressure? The answer to that question is no, you do not have any problems with your blood pressure. So you just say no, direct, a very direct answer. You don't say, no, but in the past I've had blood pressure problems and it gave me trouble for a long time and they put me on all these different medications. The answer to the question of do you have any blood pressure issues is no, because you do not. So again, sometimes in some providers, now I don't do this, I again try to apply this minimum standard, but some providers then will trigger to send out for additional testing, which can hang up your certification for an extended period of time. So make sure that when you're answering questions that you answer them honestly, but you answer them very directly. That's tip number 2. All right, so on to tip number 3. Again, another very important one that I have unfortunately had to disqualify people for or send out for additional testing, again, which is more expensive and more time consuming. So tip number 2, very important, is before you go in to take your physical, stop smoking. Now, obviously it's a healthy thing to do, to quit smoking and improve your health, but the FMCSA is very specific about this. In the Certified Medical Examiner Handbook, it clearly states that if you are over the age of 35 years old and you currently smoke, you have to have specialized lung function testing. You have to have another breathing test, basically, and most providers' offices will not do that in the office. You have to be referred out to a special testing center to have this done. Again, a costly thing, a time-consuming thing, but anybody that does not smoke, even if you've had a history of smoking, does not have to have this test done. So make sure that you quit smoking before you go in to take your DOT physical, a very important one. That is tip number 3. Okay, and last, and probably least in this particular case, this one's kind of a silly one, tip number 4, but I have actually had to send people away for exactly this problem. So I can't even count the number of times that I've had to send somebody out of my office and complete the exam later because they did not follow this tip. So tip number 4 is don't use the restroom before the test. So don't go to the bathroom immediately before you come in and take your DOT physical. Now, why is this? This is because we are going to ask you for a urine sample, and you have to provide a substantial amount of urine in a vial so that we can test for basically kidney function. We're looking for blood or glucose in your urine. Now, we do not do drug testing as part of the Department of Transportation physical, but we do urinalysis. And again, I've had probably dozens of patients up to this point come in. We get through the whole medical exam. We do the urine test at the end, and they just cannot provide a sample because they haven't drank anything throughout the day or they just went to the bathroom. We have to send these people away and have them come back. Again, it just is more of a hassle, a nuisance. It's time consuming. So make sure that you don't have to, that you have to go to the restroom after the exam and you don't go to the restroom immediately before the exam. Okay, so I hope those tips were useful. I hope they were beneficial. There are things obviously that you can do to maximize your chance for passing the DOT physical. Us as medical examiners, we don't want to fail anyone. We want everyone to pass. Obviously that's not the case, but we don't want to fail people for reasons that could be avoidable. So make sure you're following these tips and that you come prepared, and good luck on taking your DOT physical.